Hello, bonjour, and dumelang. Welcome to another episode of Sechaba. Are you listening? I am your host, Moronga Mosetli, always present, always available here in the court of Sechaba. I'm joined by my co-host, TK. Hey, bro.
Hey, I can't believe this is our last episode, eh?
Well, we had to get here at some point. I wanted to put on a sparkly dress, but I thought it would be a little awkward. So, I got cute a different way.
Okay.
Yeah. We also have a special guest. Yes, she is here today to help us dive into the world of women's health. There's lots of health issues. It's easy to go to the doctor and say, I have the flu, my chest is a little sore, my knee is broken. But there's specific things that only we women would know we need to do. Some of us don't actually know these things are important for us. There's also things men should be doing. But because we live in such a world where women are not provided with the equity they need in order to progress just personally, we would like to let you know just exactly what we're talking about when we talk about women's health and look into the kinds of things that you should know as a woman and you should be paying attention to, because at 34, I think there's a lot of things I probably haven't done that I should have already done by now. But before we get into all of that, may you please just introduce yourself and let the viewers know exactly who you are and what you do. How did you get to this point in your career today?
My name is Tlamelo Mothudi. I wasn't here from the start of the party, so I can't claim glitz and glamour. I'm just here for your episode. So firstly, thank you so much for having me.
Thank you for being here.
A really, really important and I think interesting conversation. So I am a health and human rights researcher and advocate. And I'm also a Global Atlantic Fellow in Health Equity. So my lived experiences inform my advocacy, and that's how I got into it. So my background is law, all law.
Okay.
My undergraduate was looking at sort of law, politics, and philosophy, that combination. And then I went on to do my LLB and then my master's in law. But I've always had a human rights or health lens to my law. And most importantly, how we look at policy and how policy and the law then impacts and affects and can be used in order to sort of promote and protect human rights and move towards health equity.
Yeah.
So this is my background in the space. So I think I've been working in the space now. Wow, I mean, not counting at university level, maybe working in the space for about close to 10 years, I think now.
Nice.
But, not as a healthcare professional, because that's not what I am, but as somebody who advocates for health equity.
Yeah. Wow.
Nice.
Okay.
What a resume.
At first, I thought you had to be some kind of healthcare professional. It really did not make sense to me that, I don't know, it just feels like, no, why? How do you get into that space without having studied medicine or nursing or something? But now it's like, there's again a whole other side to these things that we don't know that they have another side. It's not as simple as understanding how the human body works. There's also actual physical laws that will determine how good the healthcare in the country is, I guess, at the end of the day.
Yeah.
And that's why we need you. Okay.
Yeah, so slightly different from the ones that determine how your body ticks.
Yes.
So I think ours is more saying that we understand that our body ticks a particular kind of way, and therefore there should be services available to us.
Yeah.
And in the event that those services aren't readily available, then to question and to hold accountable those people that should be making them available.
Yes.
And, looking at not just ourselves within the context of what my body needs, but within the context of, what women need, what young girls need.
Yeah.
And what, people that might have, a different gender, diversity need, and then advocating around those things to say that in order for us to live our best lives, because physical health also works with mental health, right?
That's true.
So for us to live our best lives and to be functional within society, this is what we need as a people, as society. So that's kind of the work that we do.
Yeah.
Wow.
Okay.
Yeah.
Okay.
It's very holistic, eh?
Very.
Because when you look at it, you can fight for human rights, advocate for human rights, but still neglect certain elements in society.
Yeah,
right?
that's true.
And because I'm comparing Botswana to my country, where we have the human rights activism around the girl child, right? Where we've also formed the Girl Child Network, which is now trying to also advocate for women's health. So things like, sanitary pads, teaching young girls how to even use a sanitary pad, and providing free reusable sanitary pads. So I'm seeing that there's that relation. Did you think of it that way when you were venturing into this kind of field, or is it something that then just happened, where you want to advocate for human rights at the same time advocate for women's health?
Well, if you think about it, health is a human right, right? So it intersects on that basis. And if you think about when we go broader now, right, and we're looking internationally, we're looking at things like the Sustainable Development Goals.
Yes.
They're interlinked because, the world has recognized that you can't deal with one right without dealing with another right.
Yes.
So the achievement of the right to health is dependent on other rights, right? Because when we think about health intersects with, there's things that are called social and structural determinants of health.
Yeah.
Right. So our gender, our sexuality interacts with our social and structural determinants of health. And these then shape our health and shape our health outcomes.
Yeah.
So this is why specifically for us, thinking about women, right? That we have how certain things affect our health and how we're affected by certain diseases. And, that's how, for me, I've always looked at it. And when I actually started advocacy around health, I didn't look at it as a human right. I just looked at it as a service delivery issue. And so a lot of my advocacy was, budget related to say, what is the Department of Health, because a lot of my work was in South Africa. What was the Department of Health doing with the health budget to meet service delivery issues? And that's how I sort of got into it. And then I was also working with young women because I was a manager for one of, a residence. So I worked with a lot of young women. So a lot of issues that they faced were also issues that I advocated around. We had issues of young women that had been involved in rape, in sexual assault. And in most instances, when they went to the hospital that was in the area where we were located, they didn't have access to, for example, rape kits, which is something that's also quite prevalent in Botswana.
Yeah.
So, and a lot of times they had to sort of sit there and lament and wait for someone to assist them. So now you are sitting, because obviously, for data collection and for evidence purposes, you can't really change out of the clothes.
Yeah.
So that is kind of how I got involved in health advocacy. A lot of issues as well around my personal, giving birth and my experiences in giving birth and the availability of certain services that continues to fuel, my advocacy because I live it. And I'm a public health user. I use the public health system. So because of that, I'm also privy to the issues that I experienced in the public health system.
Wow.
Yeah. Wow. Hey, I won't lie, guys. I'm afraid of our public health system. I don't have medical aid. I'm not at that point in my life where I can afford medical aid and be serious about it. But I will find that 2, 3, 4, 500. I will discover it because genuinely, based on a lot of the experiences people have had, and even a few of my own experiences, they're not as harrowing per se. It's, 38, 39-degree fever. They don't have an ambulance to get me to the hospital. Got bitten by a dog. There's no antibiotics. I have to pray I don't get tetanus. But then there's the worst stories. I gave birth and they gave me nothing. They just said I should be strong. They stitched me, no painkillers. So I'm genuinely afraid of our healthcare system. And I don't know how people who don't have options, where would you say they maybe can go to advocate? Because even now there's stories circling around social media. Every year it's another woman, another man, another family member that has just been taken through the ringer at one of the public hospitals. And is there like recourse? Is there somewhere we can go for these issues?
Look, I hope there is, right? Because recourse on a piece of paper doesn't necessarily mean that you're going to get some kind of recourse at the end of it.
Yeah.
It's kind of very similar with how our laws are so amazing, because on paper they're like, wow. Right?
Yeah.
But then in implementation, it's something entirely different. So in every clinic, in every hospital, there's a section that outlines complaint procedures. That's always the first port of call.
Okay.
Right?
Okay.
The complaint procedure will usually go to the matron. Right. Now, the frustrating thing is that a lot of times the complaint procedure is there, but then the telephone doesn't work. It doesn't go through. So that's my experience when I then call the matron to be like, what is going on? There's no, equipment.
Yeah.
And then you find that when you do go and actually, submit a letter formally complaining, you might not necessarily get feedback. So I think it's important for us to know that as a first protocol that is there. But if I don't receive any kind of feedback that makes sense, where do I then go? Then your next protocol is obviously, to shout, like I think the recent young woman did when she had very terrible experience of giving birth, where she was like, Ministry of Health. Social media is amazing, right? We don't actually realize like how you can compel people to respond using social media platforms. I've done that a lot. I'm always like, water utilities. Water utilities is amazing because they're responsive. But I use social media when I have any kind of issues around my neighborhood, around my health, to amplify that I have an issue, address it. And then when you don't get any kind of help there, then you need to go to like the health ombudsman to be like, these are the issues that I'm experiencing. I put a complaint here, and I'm experiencing absolutely no feedback. And then there are some civil society organizations that work around health and human rights that also have the kind of provisions for people to walk in and outline what their issues relating to healthcare service delivery are. So what I would then recommend is also to touch base with them in instances where you're not actually getting feedback, because it's all about support really, right? Because if you are shouting, but nobody's hearing you, you need support of somebody who might have better standing and who could actually amplify your shout a little bit more. So that's what I would always recommend. Start at the point of call, but start, right? Start actually raising issues around service delivery and around specific service delivery issues so that they can be raised and dealt with. Because a lot of people, we go through these experiences and then we turn around and go home. We're frustrated, right? Because you've just been through the experience. You don't really want to have to deal with it. But actually documenting it means that like, it's been addressed, well, not addressed, but it's been raised. And the possibility for being addressed then becomes, a little bit easier.
Okay. I honestly didn't know that I had options.
Me too.
And again, like I've never had a truly horrible experience at a government clinic, government hospital. Oftentimes, I just have the patience to wait and like just let the frustration disappear. But now that I know I do have options, I really want to take advantage of those options. But guys, on top of making sure we take advantage of our available complaints procedures, can we also just start telling each other when they get it right? Like, I also know I don't tell enough people that, hey, I went to Mafitla Khosi or GWS Clinic or Marina even, and that particular doctor really helped me. I know I've heard it from some people. Somebody once said to me, no, like, you need a dentist, go to Marina. They have the best. And I was like, And they're like, no, for real. Like, I went there, they took out my teeth, and they are the best. So let's consider telling each other, okay? We went wrong here, we went right here. And then maybe we can get to a place where things are good. We just want to jump in the corners. You know how we do. Every few minutes, we have to disappear for a bit. We'll be right back on Sechaba. Are you listening? Welcome back to Sechaba. Are you listening? I'm still here with my bro TK and our wonderful guest Tlamelo. I'm going to do it at the end of the show. I'm going to show y'all I know this, like I do.
I got it.
Yeah, I do. She even says so herself. I do have it. But Because we should get into the meat of today's topic, may I please ask you to define for us, because today I'm going to learn a lot. What do we mean when we're talking about women's health, and where does it begin to differ from men's health?
Look, women's health is very broad.
Emma.
It's a very, very broad section. So, and I think I mentioned this earlier on to say that when we think about health and we think about our genders and we think about our sexes and how they interact with social and structural determinants of health, and how, as a result of that, they shape, right, our health and our health outcomes. So, we're talking about, pregnancy-related issues. We're talking about sexual reproductive health related issues, and I think those issues are issues that affect both sort of men and women, right? Because sexual reproductive health and rights isn't just something that is distinct to women. We're talking about issues like, again, mental health issues, because the body doesn't work alone. So those are the when we're looking at women's issues, those are the kind of category things that are distinct to us and that we go through, like pregnancies and pregnancy-related healthcare, and then things that we diseases or ailments that women and men both go through.
Okay.
Yeah. So I hope that is helpful, and sort of not to say that, it just means that if there are things that we both experience, that we just experience them in different ways.
Yeah.
Okay. No, before I go to my question, just for some of our viewers and myself included, let me not hide behind our viewers. Okay. Let me ask for myself. What do you mean by social and structural? What falls under social and what falls under structural determinants? Yes, just maybe a few examples so maybe I can get a rough idea of, because I'm hearing the words a lot and now I'm trying to think what is social, what is structural.
Okay, so determinants of health, right? It's basically very plainly what it is. Determinants of health. So there are those things that affect our health in a particular kind of way. So when we're talking about social and structural determinants of health, we're talking, for example, about the environment which we live, right? So if you live in an environment where you are surrounded by pollution, it's going to have an impact on your health.
Yeah.
If you live in an environment where you maybe are in a mining town, right, it's going to impact on your health.
Yes.
Right. If you live in an environment that is not the best looking, a lot of dirt, a lot of rubbish, is going to impact on your mental health, right? So socioeconomic conditions, so your income bracket, for lack of a better word, where you live and how you're able to access your healthcare services, because the World Health Organization, ideally, any health kind of facility is supposed to be plus minus 5K, right, from where people live. And that is supposed to make accessing the facility a little bit easier. So when now you are far, then it impacts on how you access the facility when you're sick, right?
Okay.
And then, what the facility looks like. Is it accessible to you when you go there? If I am, for example, differently abled, am I able to, what is how is the infrastructure of the facility built in order to be able to provide a service for me? So anything that, the society, the conditions, the environments in which we live impact on our health and our health outcomes. So that is what we are talking about when we say structural and social determinants of health.
Okay.
Poverty being another one of them. Do you know what I mean?
Yeah. No, I think I'm answered. I hope our viewers back home are also answered. Then my question then was going to be from your maybe researcher perspective. You also mentioned that men and women do have different health needs and health issues. Maybe it's a research you've already done. Why is it there's a higher number of women that have bad experiences in the healthcare system? Is it because they're more prone to use the system, or it's just that maybe the system is biased towards women?
I mean, fair question. But why women are more prone? I don't think I've ever heard that women are more prone to bad experiences from the healthcare system. Maybe we could say that a lot of the time, because when we talk about barriers, right, to accessing healthcare system, lack of education is one of them.
Yes.
Right?
Yes.
And, lack of information in a language that you can understand, because language in itself is a barrier, right? And that you can, engage in. We do, however, know that women are disproportionately affected, right? Just generally in society. We know that, especially in the context of Botswana, we, live and breathe in, a patriarchal society, a traditional society. And because of that, there's one gender that will always, take preference over another. So if we're looking at it in that context, to be like, all of these other dynamics that make accessing and navigating, because it's not just about accessing, right? So once you've then accessed the healthcare facility, how are you navigating it? So stigma and discrimination is a big one, right? Because when we're talking about women, we're talking about things like sexual reproductive health and rights, and talking about sexual reproductive health and rights, we're talking about things like condoms, we're talking about things like, contraceptives, all of those icky things that, it's always difficult for women, morning after pills, for you to go and then the kind of reception that you're getting from the healthcare facility. So if we're looking at it in that dynamic, then one could say, okay, are women then navigating the healthcare system differently than men? But then on the flip side, right, men also have issues with accessing the healthcare system. And mostly because, and I think it's across the board, because it's not just men and women. It's not just men particularly, but men, women, especially the younger generation. We don't pay as much attention to our health. We don't do our regular health checks, right? We don't encourage our friends to do regular health checks. So are women accessing and navigating the healthcare system differently from men? Because also men are not really accessing the healthcare system as much because of stigma and discrimination related as well, pertaining to men.
Yes.
I mean, if I have to go to a healthcare system and then have to explain to someone that my gender is not or my private parts, let me say, I was supposed to say member, my private parts are not working as well as they should. A lot of times you are met by someone who's of the opposite sex, and it's a difficult conversation to have.
Yes. No, I think
you know what I mean?
You put this whole in my English. Yeah, exactly
it's
that. Yeah, no, I think
it's not clear cut.
You touched on what I was trying to ask, but I didn't know how to. The English had just ran away. So you hit the nail there. Thank you very much, because now it's making more sense. Like the access and the navigation, it's not necessarily about who's accessing what at what time. It's just about you definitely. I'm
So going back to those social and structural determinants of health, right?
Yeah.
Because we know that we do a majority of things. So we are mostly, even in the informal sector, occupied, right? Whether we are tasked with minding children, tasked with, huapa dijo, tasked with, going out and working in the fields, tasked with, and a lot of the time, this is why you find that girl children are even out of school, right? And are not going to school. So when you think about it, access and navigation in the context of all of those dynamics, then it gives you, a slightly different picture of what it is to be able to access, knowing that access is not just the physical structure. Access is a physical structure. It's the medicine in that structure, is the the expertise in the structures, the healthcare or health resources, or rather human resources for health. It's the language and availability of information. All of those, then you look at the picture of what it means to access and navigate for a man and for a woman.
Wow,
that's really fair. And I thought to myself, well, I don't want to end up pregnant. Like I'm still in school. I can't afford a pregnancy. And I went to a pharmacy and I asked for contraceptives, and they said, well, you need a doctor's letter. It's like, that's kind of weird, but okay. I went to the clinic. The clinic said I had to wait for my next period. I was like, that is also very, very weird. Then I went to see a gynecologist. I just saved up that allowance and I went to physically see a gynecologist. And the gynecologist said to me, no, it's fine. I can just write you a prescription. Asked me like 10, 15 random little questions. Then wrote me the prescription and then says, have you ever checked your sexual health? Excuse me, what? What do you mean? Okay, so you've never had a pap smear. You've never had your blood tested. I mean, I have, but it was that time when I had a kidney infection. Like, do you mean like that? No, there's like a process we go through.
I think that the gap is when we talk about sexual information, right? And I specifically termed it sexual education or sexual information because, for it to make sense, it has to be comprehensive, right? And it has to start off, I think, much earlier than where it is.
Yeah.
And it has to go over and above just, this is what your anatomy looks like as a woman and as a man, right? And has to extend towards, yes, great, this is what your anatomy looks like. It's important for you to know, okay, this is where everything is.
Yeah.
But over and above that, sexual transmitted infections, right? What does that look like? Condom usage, not just for men, for women, right?
Yeah.
As well, because a lot of them education is putting a condom on for a man, but not really how do you put a condom on for a woman.
Yes.
And it also goes with finding more condoms for men readily available and for free. When you get to that little point where it's like, get a condom. I always go and look, okay, like what are the options? And it's usually condoms for men and not really for women. So comprehensive sexual education, that is designed specifically for certain age groups because you can't have the same conversation with a 9-year-old that you can have with a 24-year-old. You know what I mean?
Yeah.
So designed to respond and to educate because comprehensive sexual education, it's not intended to entice children into having sexual engagements. No, it's intended to empower, right? Kids with education to know that at some point my body's going to go through menstrual cycle, right?
Yes.
And this is what a menstrual cycle is about. It's my body cleaning itself. This is what it looks like. These are the things that I have to do, etc. Right? When I want to start having sex, what are the consequences of that? Like I have to be very clear about the sexual partners I have, the kind of sexual practices I have. I have to make sure that I protect myself. That's the whole, I think, importance around it. So over and above that, comprehensive sexual education at a school level, okay, then we move from school to university. And I think that it would be beneficial if we did more first thing first campaigns, right? I was, I guess I can say that I benefited from a first thing first campaign because what it does, and it's a campaign that is used internationally, and what it does is just gives a platform for people, and it's usually a campaign that is directed at universities, right, and colleges, and it's designed to give people a platform for them to come and test. Right? And you can do like pap smears where you can appoint to go and get a pap smear done. You test for TB, blood sugar, HIV, AIDS. And the nice thing is that there's also counseling facilities that are there. You can come by yourself, you can bring your partner, you can bring your friends, you can bring your friends' friends. And that way everybody also gets educated and you get an opportunity to just check up on yourself because that's what it is, right? Although we have a right to health, we also have responsibilities. And our health is our responsibility. So don't wait until something happens. We also have a duty to educate ourselves, especially as young women, because, our body works in a particular kind of way. And you find that even because of lack of education, after childbirth, we don't know that you can actually get cervical cancer. It's something that is a possibility after childbirth. Really? So small things like that, and doing these smears, right, in order to see is it okay, and that then means that people from an early age have information. But it's not just the responsibility of our schools and our higher education institutions, right? It's also the responsibility of us as parents, as sisters, as mothers, within the communities in which we are, to have these conversations with our kids. Because you also, you at home, there's an environment. It's not always that way, because we know gender-based violence, we know the high statistics of rape and, child assault in Botswana. We know those things are there. So the home environment isn't always the most safe environment for a lot of women and girl children in Botswana.
That's true.
But this is supposed to be a safe environment where, as a mother, you can have those conversations with your daughter. I remember the first time I went on my menstrual cycle, I thought I was dying. I was like, what is happening? Why am I bleeding? I had to call my mom, like, Mom, am I dying? Over and above that, also getting, men, our brothers, our husbands engaged in education as well around, because we have sisters, right? We have daughters. So what happens when I'm on a business trip and my daughter starts her menstrual cycle, and does he now stop everything and jump in the car and go to the nearest clinic? Or is he equipped to have that conversation, calm her down, take her to a shop, support her through the process, call mom, are you okay? Yes, don't worry, dad's got everything. So, comprehensive education encompassing everyone, right? Nobody's left out. We're all having it. So it becomes like, how are you doing? How you doing?
Yes.
Fine. That's what that education must look like and must produce. Like, we should be able to just, even with our eyes closed, have it.
Wow. It was quite informative from this side. I'm I'm learning. And what's really important is what you mentioned, the comprehensive sex education, and making it also holistic, to say that it's not just for the private schools. It's not just for the medium English-speaking schools. It's also for even the government schools. And I like how you even said you can't have the same conversation with a 24-year-old as you would with a 9-year-old, because it's always about this whole thing of you're taking our child's innocence. Because I did a research for my honors thesis, which was the early sexualization of prepubescent children, where parents would actually then put their children on puberty blockers to try and slow down the girl from actually developing early, because they're scared that their child is going to be sexualized too early, right? And we're like, but what message are you sending to your girl child? Is it so you're trying to show her that it's not okay to be a woman, or what exactly are you trying to tell your child who has to go through this process? So now, when you're talking about this, it's also educating even the parents to say, listen, as a woman or as a girl child, this is what your child is going to go through, and they're going to need your support. And then I also liked the element where you brought in the man in the conversation. I was one such man where if someone brought up the P word, we used to call it the P word.
The P word.
If you brought up the P word, I would huddle and hide and close all doors. My mom would be like, no, can you go buy me? Always. I'm like, no, I'm busy. I'm doing assignments. But then it came to a point where, like you're saying, where I had a cousin, and we're the same school, and she accidentally bled through her pants. She calls me, and then she
sent a bird.
She's like, no, I bled through. I need, pads. I need tampons. I'm like, you, not me. And then I'm like, okay, fine, I'll do it. When I was in the aisle, I didn't know there were different types. There's heavy, regular, there's all night, there's maxi, there's the thing. I'm like, where do I even start? And I felt embarrassed, not by me picking, but by my lack of knowledge, to say, what if I was an only parent where, let's say, God forbid, my wife passes on, and then I'm left to raise my baby girls. Who's going to teach them if their father is so ignorant to want to learn these things? Like, there's a lot of stigma, like you said, when it comes to also some things that women face. We stigmatize the most natural of things. So I think it's time we bring more people like her to have more discussions, because I love the passion that she speaks with. I didn't have a question. I just had an addition.
Well, I must say, TK, you can technically be like my father. And I knew this at the time because, I'm there, cute little 15-year-old girl. He's in the house as well. I'm bleeding, and I'm like, but the man doesn't know anything. He's a man. Like, what's he gonna know? So I'm there trying to call every woman I can think of, everybody in my phone. At some point, he goes to my bathroom. He sees that it's kind of messy. I think he saw some blood. He tried to ask me if I was okay. Yeah, Dad, I'm fine. What? Don't worry about me, man. I'm cool. But then later on in the evening, after one of the people I talked to snitched, 'cause, they straight up snitched on me. He came to my room and he's there. Like, I could see in his face that he's just sad that I spent the whole day just, please help me, I'm dying. Instead of, Papa, the things have happened. He ran me a bath. He told me it's going to be all right. He gave me 2 anvils. He asked the housekeeper to watch me. And then he went to the quick shop. He bought a packet of pads. He sat me down. He's like, look, this happens every month. What you're going to do is you're going to open this guy up and you're going to wrap it around your panties. Like, but why is it so thick? I don't like it. Morongo, I really don't know. But like, this is what the other women use, okay? This is how it works, okay? I don't have all the answers, but it's going to hurt sometimes. And here you go, finished with me and then just put me to sleep. Next day, he's like, you're not going to school, okay? We're not doing this today. You're going to stay here and get used to yourself. So you really do have that option. I'm pretty sure he didn't just learn it because he had sisters. My dad was stuck with 2 girls. He had no choice.
But to learn.
Also, to you, brother out there, guys, how old was I? 15 plus 36, that's 45. If a 45-year-old man, is it 45? It might be 50.
Let's estimate. It's okay.
Yeah. If a 40, 50, 60-year-old man can proudly walk into the quick shop, grab a packet of Always, and then come walk his daughter through her first period, my brother, you can do it too. I actually literally only have one more question because this is something that has pained me all my life. So, all of us, okay, not all of us actually, a few of us in our 20s, we would go to the club, we'd party, then we'd go home with their partner, the significant other, whoever is with you at that time. You really don't want to be pregnant, but here's the thing. When you go to any one of the clinics here, they will tell you that the only way they can help you is if you were raped and you have proof. And then it's like, but guys, I'm trying not to become a statistic. Like, I watched 16 and Pregnant. I watched Teen Mom. That scared me of having kids before I was ready. And I know the times I was being reckless for the sake of being reckless, I shouldn't have been. But there are so many people I know where it was a literal mistake. They did not mean to end up in the position of being pregnant in first year, second year, at the end of Form 5. But still, literally everybody I know who has had an abortion or gotten contraceptives, they did it on the slide. They did it in the bushes or they crossed the border to go do it. And why is that? Why is it that here it's so difficult to ensure that, I am not adding to this problem of poverty and this problem of children born into a family that's dysfunctional, essentially.
Sure, it's very unfortunate, hey, and quite unbelievable that in 2024 we still have to have a conversation about termination of pregnancy or abortion services, right, and the right to that.
Yeah.
A lot of the conversations are usually religious orientated and based, I think, on a lack of proper understanding about should abortion services be made like legally provided for in Botswana. What would be the age group, for example, of women or young women that are able to go through the termination of pregnancy? At what week would the termination of pregnancy take place? So all of those things are the reason why also traditional society, all of those are the reason why I think we're still, and also I think lack of political will, right? How are we still women in Botswana telling you what we need?
Yeah.
And asking you for permission to make decisions about our bodies, because that's ultimately what it is, right? And then you think about the context of abortion services where marital rape isn't considered rape in Botswana. Right?
Yeah, things like that.
And how young women are forced into marriage and then they get raped and they don't have access to any kind of facility because what do you mean you were raped in your marriage?
Yeah, like he's your husband.
He's your husband, right? Because people still believe in conjugal rights and our legislation, our policies still talk about conjugal rights, right?
Yeah.
Like sex doesn't involve decisions, that involve two people.
Yeah.
So that is why I think we are where we are. And I think it's also got a lot to do with the fact that the right to our sexual reproductive health and rights is not something that is in the Constitution. The Constitutional Amendment Bill says everybody has a right to health, but doesn't include sexual reproductive health and rights and doesn't include mental health, right? So how then, because the Constitution as the highest law of the land is supposed to be a compass in a fair, just, equitable society where rights are readily recognized and protected, this is what Botswana should look like. So that is part of putting rights like that in the Constitution, because then it obligates our leaders and it shows the country that our leaders are prioritizing health, sexual reproductive health and rights. Yeah. Although there's mental health, people will be like, no, but there's mental health legislation. That's great. It still needs to go in the Constitution.
That's
right?
true. That's true.
The fact that it's not in the Constitution then means that we can't then develop other pieces of legislation of that, saying that our Constitution says we have this right. And therefore, within this right, we want to legislation around termination of pregnancy services. So I think it's a lot of different factors that are the reason why, again, in 2024, not that Botswana is distinct. We're not distinct.
Yes.
Right?
Yes.
We are not the only country in the world that doesn't have abortion or termination of pregnancy services.
Yes. Recently, America had the permission to overturn Roe versus Wade.
Imagine. Imagine. It's absolutely shocking.
Of all the things y'all could
in
overturn
reverse.
as a nation, guys.
Of all the things. And it's such a shame because, when you talk about getting services on the side, the backdoor services, right? You're finding that there's so many health complications. We spoke to some healthcare professionals, doctors, and they were like, we don't know why termination of pregnancy services aren't a thing in Botswana.
Yeah.
Because we come through so many cases where young women are having termination of pregnancy at home or backdoor. And then they come to us with these infections and these issues that now we have to address as the public health system. Whereas if we had it, we wouldn't be going through as much.
Yeah, that's very
So
very
I think
true.
as a country, we really need to introspect because we have so many differing issues that should have resulted in us having termination of pregnancy services by now.
Yes, yes,
And
definitely.
I don't know whether we shy away from those issues or whether they're actually just not taken on and we're not having honest conversations about the state of our public health system and the kind of services that are needed by, since there's a conversation about women in particular in Botswana, right? And also the inclusion of the right to health and sexual reproductive health and rights services in the Constitution also means that we can hold our governments to account.
Yeah.
We can say that, you have done nothing in the last 5 years to progressively realize this right. What are you doing?
Yeah.
Then we start looking at the budget. Where's the budget going? Is it going to where it should be? Is it doing what it's supposed to do? Or are we experiencing sort of over expenditure, wasteful expenditure where a majority of the budget is going towards health, but we're not seeing those outcomes to equate what is being allocated with how it's being responded to. And we still have shortages of personnel, like I mentioned earlier on. We still have shortages of medication when you go sometimes. So all of this affects health, how you access health, and how we continue to have conversations around health. So it's a factor of different things, I think.
Yeah. Whoo, Botswana.
Yeah, we have a long way to go. We've done well. We've done well,
but guys,
we are like, yay, great with our AIDS statistics,
yes,
right?
Yes, but thank you, government, for that one.
Which is
at least.
amazing.
Yeah.
But within that yay for health statistics, there's still the stigma and discrimination that is preventing us from getting to where we could.
Yes,
right?
that's true.
So we have these amazing things that are happening, and then we're like, but we could really work on this. This is the pivot, right? Considering gender-based violence in Botswana, considering, rapes of young women and men in Botswana, considering, there's so many factors, for example, marital rape. Why aren't we using what our data, what we're seeing, to inform how we move and how we create policy that responds to that, which is supposed to be what we are doing.
Yeah, that's very, very true. I hope in 50 years I'll still be maybe that's long.
You'll be alive.
Maybe that's
You
long,
will be.
long time
You'll be
from now.
alive.
But I do hope I get to see parts of this Botswana. Personally, I would like to walk into a pharmacy and grab some contraceptives without needing a letter. That's where I'd like to start. Then maybe, abortion would be a nice option. I'm not exactly sure what men need, but right now, guys, I think y'all need just to go to the doctor. I think y'all just need to get comfortable with getting checkup. See your GP, get them to check the regular things like your cholesterol, your blood pressure, your sugar, your iron. I'm not really sure what the others are, but like these things matter because when you're 80, 90, you'll be surprised at how much you missed out on just by not knowing that your blood pressure was a little high or your iron was a bit low for years at a time.
And also even on the mental health side, just check up your family history.
Yes.
Because things like dementia, Alzheimer's, so sometimes, it comes as a shock, like, oh, I didn't know this, but you could have also kind of started medication early to it doesn't prevent it, but it can slow down the degeneration of the brain cells. So sometimes just knowing your family history can help both men and women.
I challenge you, dear nation. On our last episode of Sechaba, make Botswana safer, make Botswana healthier. You've listened, you've heard, you've understood everything we've tried to tell you. This is the end of Sechaba. Are you listening? Please make it worth it, guys. Let's make sure that tomorrow we build a better Botswana. Thank you very much for this journey, TK. I've enjoyed having Buffy around.
I got a new nick. For those that are watching, this nickname just came up during the shooting of this podcast.
Maybe
just so you know. I don't walk around calling myself Buffy.
Shout out to Mr. Producer for helping us with that one. We like you very, very much. And thank you very much, Tlamelo, for joining us because I think you've made this. My other guests are going to get jealous if I say you made this the best episode.
Well,
I think you've made this a truly special episode.
Very special.
And I think this gives us a reason to say, somebody out there, help us out with a season 2, please. Until next time on Sechaba, are you listening?